While the incubation period of the virus was initially thought to be 14 days, multiple cases have been reported with shorter timelines. A study by Guan et al. Calculated the median incubation period to be 4 days with a lower interquartile range of 2 days and an upper interquartile range of 7 days. In their study, the most common finding on imaging was ground glass opacity on CT, 56.4%. They found that 43.8% had a fever on admission and 88.7% during hospitalization. The cough was also a common symptom and was seen in 67.8% of patients. The Chinese Center for Disease Control and Prevention has reported that 87% of confirmed cases were in adults aged between 30 and 79 years. The mortality and case fatality rate increased with increasing ages. The case fatality rate was 8% in patients aged between 70 and 79 years, while it was 15% in those aged 80 years or more. Treatment of COVID-19. Multiple antiviral regimens are being tried to help patients with severe symptoms of the virus. Lopinavir and ritonavir have been used in some clinical trials. Lim et al. Reported that the drugs helped their patient as he improved clinically and viral loads decreased significantly. 4 COVID-19 patients were recruited by Wang et al. For a study in Shanghai, China, and they also improved with a combined therapy of lopinavir and ritonavir. In Singapore, confirmed cases that were hospitalized were also given the combined antiviral therapy of lopinavir and ritonavir. While some patients reported improvement in their symptoms, 4 patients developed nausea, vomiting, or diarrhea, and 3 patients showed elevated liver function test results. Several other treatment options such as remdesivir, Gilead Sciences, Foster City, CA, peptide, EK1, neuraminidase inhibitors, chloroquine, and Arbutal have also been suggested. There are multiple research teams trying to investigate a possible vaccine for the virus. The role of the spike protein in the viral infectivity and pathogenesis is a possible preventive target. How to prevent COVID-19? The CDC recommends multiple steps to prevent the transmission and risk of SARS-CoV-2. Frequent hand washing lasting at least 20 seconds by using soap and water is advised. Hand sanitizers with at least 60% alcohol can also be used as an alternative. The public has also been told to avoid touching mucosal surfaces such as the mouth and the nose with hands that have not been washed. Anyone showing symptoms of the virus should try to seek appropriate medical help. They should also limit their exposure to other unaffected people and cover their noses and mouths when coughing or sneezing. They are also advised to wear a face mask if they present with symptoms. Frequent disinfection and cleaning are advised for groups that are at risk of contracting the virus.